There are many ways to keep your heart healthy. To understand this better, I spoke with a cardiologist who explained heart disease and how you can reduce your risk of developing it. And that is tonight's Healthwatch 16 report.
Healthwatch 16, sponsored by UPMC, life-changing medicine.
Heart disease is the leading cause of death in the United States. That's according to the Centers for Disease Control and Prevention. It includes various conditions affecting the heart muscle, valves, and electrical system.
The most common thing that people equate with heart disease is a blockage issue or coronary artery disease. That's your classic heart attack, chest pain, needing to have bypass surgery or stents.
Dr. Thomas Scott is an interventional cardiologist at UPMC. He adds that a buildup of plaque leads to heart disease.
What happens in essence is that the arteries have a blockage process that starts that leads to a narrowing in that artery, which reduces the amount of blood flow that can actually get to the heart muscle.
Risk factors include
high blood pressure, high cholesterol, diabetes, smoking, and a strong family history of heart disease.
Also, be on the lookout for signs and symptoms of heart disease, including chest pain.
A lot of times patients come in and they say, well, it's not really pain. So what I like to tell them is pain is any sort of uncomfortable sensation in your chest. That can be a pressure, it can be squeezing, it can be tight, it can be aching, it can be burning. And that pain may or may not radiate into your neck, jaw, back, shoulders. Sometimes people get short of breath when they do things.
If you feel nauseous and sweaty, these could be signs of a heart attack. To find out if you have heart disease, start by talking to your doctor about your health history.
Things as basic as an EKG that you get in your office pretty routinely. And we have more specialty type testing where we can do pictures of the heart with ultrasound. We can do various types of stress tests, either on a treadmill or with medications to simulate exercise.
Doctors say they also use cardiac MRIs, CT scans, and cardiac catheterization to check for blockages. To lower your risk of heart disease, get routine screenings.
Get your blood pressure treated to appropriate levels, get your cholesterol treated to appropriate levels, have your diabetes managed if you happen to be diabetic, stop smoking if you happen to be a current smoker, and then also discuss with your healthcare provider about lifestyle modifications.
Dr. Scott says treatment for heart disease may include medications, stent placement, or open heart bypass surgery. If you experience persistent chest discomfort, call 911.